So asthma is a disease that is characterized by airway inflammation and bronchial constriction or bronchial reactivity. So these patients have inflammatory cells in the breathing tubes and have muscles underneath the surface of their breathing tubes that get bigger and bigger, and they start constricting and causes trouble with air flowing out of their lungs. Asthma occurs in various degrees of severity in different people. For someone with moderate persistent asthma, they have, despite being on medications, they would have airway obstruction causing them not be able to exercise, limited in terms of shortness of breath, and not be able to sleep. They wake up wheezing. It interferes with their work. They will lose different days of work because they had to go to emergency room, doctor's offices, urgent care centers. They tend to sometimes get treated with steroid medications that would cause them to gain weight, raise their blood pressure, cause them sometimes to be diabetics. So they become overweight, and all of those things interfere with their life in many ways. The conventional therapy for asthma is inhaler medications, and they focus on suppressing the inflammation that the asthmatics have and also provide them with some dilatation of their breathing tube, facilitating better breathing. Bronchial thermoplasty is a catheter-based treatment option that is done through a bronchoscope that is introduced into the patient's breathing tubes. What it does is, as I mentioned earlier, these patients have smooth muscles underneath the surface of their breathing tubes that become bigger and bigger. And as they get bigger, they constrict more vigorously, causing the airflow obstruction to be more severe. The catheter that we introduce through the bronchoscope decreases the bulk of these muscles and thereby making the airflow easier. The procedure is done in 3 stages. We use thermal frequency waves to debulk these smooth muscles. So it's a heat-based treatment option. So we don't want to apply the heat to all the areas of the lung at the same time, and therefore we do it in stages. The first stage is one of the lower lobes, and 3 weeks later we do the second lower lobe on the opposite side, and then 3 weeks later we do both the upper lobes together. So it is done in 3 stages, and before and after each stage we measure their lung function with the lung function study to assess their treatment response. And the recovery time is fairly short. It's an outpatient procedure. Patients tend to go home the same day. We monitor them for 4 hours after the procedure, so the patients typically spend about half a day in the hospital and then go home. And then they're back to their normal activity, baseline activity the following day. Yes, the procedure is recently approved by the FDA. The studies that have been done have shown that this procedure decreases the severity of asthma. It decreases severe asthma exacerbations by about 32%. It decreases hospital admissions by 73% and decreases emergency room visits by about 82%. And this is certainly not a cure for asthma, and so I always tell my patients to have realistic expectations, but it certainly decreases the vigor of asthma and makes it more livable with asthma, especially in terms of quality of life and time lost from work and time lost from social activities. Yeah, the patient that I recently did quite well. She's a young nurse who actually had lost her job because of frequent asthma exacerbation. And after the procedure, she did very well, and she was able to go out shopping with her daughter, which she was unable to do. She was able to walk from the parking lot from my office to my office, which is a considerable distance. She was able to walk very easily, which she was unable to do before. She had to always stop and catch her breath. She's looking forward to going back to work, and she's done extremely well. And we anticipate her going off her prednisone. She actually lost 21 pounds just by being more active. after the procedure, and she had gained significant amounts of weight because of her inactivity, because she was always short of breath, as well as the prednisone she was taking.